that answer your question?
Senator McKissick.
Thank you, Mr. Dr. Wayne. I have several questions. And first, I would like to know, in terms of your thoughts, what do you think are the most significant, tangible outcomes that you could identify that your agency, or I can say agency, but consulting group has brought to the table as a result of working with our Department of Health and Human Services?
Thank you, Senator. Overall, very key is to put in place a dependable, reliable financial model so that I think you're all in your positions and responsibilities can have a confidence in the fiscal forecasting put forth by DMA, and that's foremost in terms of our responsibilities. That is critical, obviously, as Medicaid is such a significant portion of the state's budget. So I'd say that that is really one of the most critical elements. And part of the way we work in terms of having responsibility, not just developing a model in isolation, but really working with the individuals in DMA, in DHHS, OSPM, fiscal research, and having that coordination, we can understand how this model needs to operate. And I think, as was highlighted, it has to be, by Dr. Cummings earlier, it has to be very North Carolina specific, although we can bring the perspective that we have utilized in other states and other programs.
Follow-up, if I may.
Follow-up.
Now, as I recall, when our state entered into a contract with your consulting group, it was a direct contract. It didn't go through a competitive bid process. Is that correct?
Yes, I believe there'll be more discussion about this, but yes.
Sure. Okay. Now, let me ask this, if I could. How many consulting groups or persons would you be able to identify that you would say would be comparable consulting firms, groups, or entities that are also engaged in this same type of business or service that you provide?
Frankly, sir, that we are unique in providing the services in a comprehensive manner and providing a combination of fiscal modeling, budget analysis, and providing day-to-day leadership support for execution of functions.
Follow-up, if I could.
Follow-up.
Are there times when you do submit competitive bids in other states to go in and provide, say, similar services to what you're providing here, or something that is along those lines? And I'm just wondering if there are, who would be the other entities that you might be in competition with in terms of submitting proposals to take on a specific engagement?
There are situations, and I can highlight, where we have been in a competitive situation and have been awarded a competitive contract. Then that contract has been amended to add some of these leadership responsibilities. But typically, that aspect of our work is not part of the competitive procurement. So where we have gone to competitive bid for services that we provide, in many cases other firms that we might compete with would be from the turnaround perspective. And there are several firms that come to mind, and then some that provide strategic consulting like McKinsey, Boston Consulting Group, but we uniquely provide usually that leadership day-to-day perspective.
Follow-up, if I could. Who would those firms be outside of McKinsey and Boston Consulting Groups that you could identify? And then are there times when you work with them as part of a consulting team to do engagements? Because I know that's not uncommon.
Correct. Yes, we do work hand in hand. There are situations, for example, where we work with McKinsey. When we worked with the New York City Public Schools, they defined a strategy, and we helped to provide the restructuring support to implement that strategy, providing folks who served in chief restructuring officer positions and providing leadership for areas like special education. So that would be an example where we have provided teams and worked with other teams. Historically, we've also worked with other firms like Mercer Health and Benefits, who provide specific support in some of the other states that we've worked with, including here in North Carolina, as well as in Pennsylvania, where they provided some actuarial services that are unique to their skill set and capabilities, where we provided a lot more fiscal analysis and modeling.
Thank you.
Representative Dollar?
Thank you, Mr. Chairman. I've got a couple of questions. I want to follow up on just something real quick. You mentioned a moment ago that you've done work in South Carolina, and that, as I recall, South Carolina's Medicaid program is about roughly half the size of North Carolina's program, and you indicated that the director down there of their Medicaid program, when y'all came in, had a $250 million problem. So that would roughly translate to a $500 million problem if you were here. What time frame was that? Do you remember roughly what year that was?
We jog my memory, apologies. But we came in, I think we started working with them, I think it was about 3 years ago. We were in place and supporting them for a little over a year after that. So it would have been starting about 3 years ago, completing about 2 years ago.
Okay, and just to follow on that, you, South Carolina's delivery model in terms of their Medicaid, isn't it principally through managed care companies, through insurance companies?
It has transitioned over the course of the last several years. So when we were there as reforms were taking place, yes. So at this point, yes, there are much more managed care organizations in place, and that had come about as part of the reform that was put in place under the current secretary.
Another question, and this one is for Dr. Cummings. And Dr. Cummings, my question to you is that results are really what matter most, it seems to me. And from the Secretary's prior comments, I think earlier, and I think there are going to be some budget discussions a little bit later, but I suppose after lunch, you did come in this year for the first time in a number of years with a cash. You had cash at the end of the year, and at the end of the year, of course, there are a lot of settlements that have to be done during the July timeframe. But what role would you say that A&M played in helping get the department to a position from where we were hundreds of millions of dollars in trouble, shall we say 4 or 5 years ago, to now ending fiscal year with an actual cash surplus in Medicaid?
I think their role was key and indispensable, especially since their arrival back around the January timeframe, and certainly in the last 3 months. But I've seen weekly, sometimes twice weekly meetings with Rod Davis, our DHHS CFO, meetings with other representatives, constant meetings with Office of State Budget and so forth, as well as departmental meetings, going over again, as I described, in some cases line item by line item, to make sure that we had a good handle on where the money was going. And if we saw something, and if something was seen that was getting out of kilter, the question was asked why. What's going on? What should we do? How do we respond? And so I just think careful oversight and management that they provided, and the additional skill sets they brought into the table were very indispensable, and in my opinion, resulted in a very positive outcome.
Senator Tarr?
Thank you, Mr. Chair. I'm going to jump in the weeds a little bit. This is for Dr. Glenn mainly, and going around the data governance. First of all, was there any collaboration with NCHIE or GDAC on that activity?
I think overall, we have, as I mentioned, we have primarily looked at the roles and responsibilities and highlighted that Steve Feather has been put into place as this in terms of the roles and responsibilities, but did highlight that we have not officially kicked off our involvement beyond that area, and we're not set to do that yet. So I apologize, but I can't go into detail on that.
Follow-up? And then, if you're doing the data governance, can you talk to, or what will be the deliverables? Will we have a template data model? Will you get into CRUD analysis at all? Are you familiar with that term? If you could elaborate.
We will provide support and as the Secretary directed to Mr. Tedder earlier, we're going to provide support specifically related to the flow of fiscal information as it feeds into the forecast model and the budget model. There are many other activities underway in the business information organization, and Mr. Tedder can expand on those. That's our primary focus of interaction, is to make sure that there's been reconciliations of historical data, that we have reliable data that we're looking at when we look at fiscal trends and analysis. Clearly we're looking at where data was from programs and services that put us in a better financial position to close out the fiscal year of 14 as we look into projecting into 15. So I can let Mr. Tedder kind of expand on some of the areas of data governance as well.
The primary focus initially in the data governance is recognizing the amount of difference in the way Medicaid looks not only to the fiscal agent but also to the DMA organization. And so the primary focus is to work on getting those connections reestablished, how information is coming in, how it is being used, the terminology has changed, the access methods, and the way people used to ask for information also has to change. So there's a whole lot of, for lack of a better term, semantic calibration that's got to take place, as well as the fundamentals of data governance. Are we getting what we expected? If we didn't get what we expect, why not? That's the input side of data governance. As we roll out with the NC Analytics, one of the key aspects of that is trying to push data analysis and data gathering to be more self-serve. There's a huge component of data governance in that, and making sure that people understand what they're asking for, understanding what they're getting, and making sure that we don't get into the situation where 5 people answered the same question themselves and come up with 5 different answers. So the data governance at this point is just making sure everybody understands what they're getting, what they're not, and using it correctly.
One last follow-up. This is more of an information request, and it's more for you, Dr. Glenn, you and your team, and I guess people can sharpen the pencil as they go through this, but I'm happy to put the list together. This is going to take a second to read, but I think it's based on a lot of the questions that are being asked that would help us in picking up on Representative Lambert's questions around KPIs, is some basic management information overview at a summary level, kind of board level, if you will, that hopefully none of what I'm about to ask for doesn't already exist, because it's not to add to your burden. But I would start with, from the lean projects, what the summary findings and observations are, any quantifiable benefits, where they would be. I think it'd be nice to have a list of your targeted KPIs that you've done. On the budget and forecasting, I'd love to see an overview of the model and the algorithms within the model and how you're actually determining budget certainty, and actually even a demo of that would be a marvelous thing to have. Relative to the individual initiatives and projects, can you break out by projects just an overall summary work plan by project that would show what the deliverables are, what the estimates to complete are, looking at then also budgets, what budgeted versus actual and stats against those contracts. Would love to see your burn rates on those as you go through, and then the last thing associated that with any issue log. Major outstanding issues at least our level that are either policy directed, financially directed, or would impact organizational structure. Details we don't need to look at. So, thank you.
Representative Murray.
following up on what Senator Tarr just said, I also like to see what the changes from the previous modeling were. We had a lot of issues on how we modeled costs for Medicaid, and you made some changes. I'd kind of like to know what those changes for the model were to help us be more predictive as we move forward. Other point I wanted to make and get your feedback on is connection to the providers where you're going to execute patient, where you're going to have execution on improving patient care. And so when I ask the questions along the lines of how many patients do we have in Medicaid with diabetes, how many patients with diabetes that we have are at goal, how much would it cost us to get those patients to goal, and how much would it save us if we did? That's kind of the 2.0 version of Senator Heiss's question on how many patients do we have. That's a great number to have, but as a provider, I kind of need to know what patients I have and what conditions I'm treating. And so to that end, we have robust provider networks across the state of North Carolina, and I wanted to get your feedback on how your interaction with CCNC and the provider community has been on providing good data to providers so I can actually make patients better and bend the cost curve that way.
I can address the question with provider network.